Dexamethasone is really a fascinating drug. It's a fluorinated glucocorticoid with a wide spectrum of uses, from treating rheumatic issues and severe allergies to even playing a critical role in COVID-19 care.
Yep, right. And it's interesting how it spans so many areas. What jumped out for you about its overall profile?
Well, what's impressive is its multifaceted nature. It's used to soothe inflammatory responses in conditions like rheumatoid arthritis, in skin disorders, and even in high-altitude illnesses like HACE. Plus, it's been essential in protocols from preterm labor to reducing edema in brain tumors.
And not to mention its role in surgeries, right? It helps minimize nausea and pain post-op, and even in some dental procedures to counteract swelling.
Exactly. It's available in different forms: oral, intravenous, intramuscular, topical, and even ophthalmic drops. The versatility in administration really sets it apart. Its rapid onset, usually within a day, and the roughly 3-day duration of effect makes it quite manageable clinically.
I find it fascinating how something synthesized in the late 50s has maintained its relevance. It's been on the World Health Organization's list of essential medicines for decades. How do you think that longevity ties into its chemical properties?
Oh, for sure. Its molecular structure, a synthetic pregnane corticosteroid, gives it potent anti-inflammatory and immunosuppressive properties, and it's roughly 25 times more potent than hydrocortisone.
Exactly.
Plus, the high selectivity for the glucocorticoid receptor over the mineralocorticoid receptor explains why it has minimal mineralocorticoid effects compared to endogenous steroids.
That's right. And its synthesis is really neat too, starting with 16-beta-methylprednisolone acetate and going through a series of chemical transformations with hypobromite to get that final epoxide structure. It's like a well-choreographed dance of molecules.
Yeah, it's like the synthesis process is as intricate as a finely tuned watch. And then, to confirm you've got the right product, you'd run spectroscopy tests: 1H-NMR, 1,3C-NMR, mass spectrometry, infrared, and even UV/VIS. The NMR peaks, for instance, clearly indicate 29 hydrogens and 22 carbons, which is crucial for verification.
That's a great point. And on the topic of chemistry, the differentiation from similar compounds like betamethasone is just a stereochemical twist. Literally just the spatial configuration differences at position 16, right?
Yes, spot on. It's an enantiomeric variation, yet the clinical impact is huge. And speaking of clinical, the adverse effects aren't trivial either. Long-term use can lead to things like bone loss, muscle weakness, even cataracts. So, the therapy has to be carefully balanced.
I remember reading that its long-term use can also result in issues like hyperglycemia and impaired wound healing. How do you reckon clinicians weigh those risks when prescribing it?
They really have to tailor the dosage and monitor patients closely. It's a balancing act between harnessing its anti-inflammatory benefits and mitigating risks like immune suppression or osteoporosis. It's not a one-size-fits-all, and the decision-making often takes into account the severity of the illness.
Exactly. That makes sense. And speaking of severity, its role in COVID-19 treatment really put it in the spotlight, didn't it?
Absolutely. The recovery trial showed that dexamethasone reduced deaths in ventilated patients by roughly a third, and in those needing oxygen by about a fifth.
Yeah.
But it's important to note that for patients with mild COVID-19, use might actually be harmful. Hence, its use is strictly recommended only for severe cases.
Right. It's interesting though. While it's so effective in severe inflammation, there's been a fair amount of debate about using it in patients who don't meet those criteria. I mean, isn't it risky if administered to someone with a mild case?
That's a valid critique. The guidelines are pretty clear that it should only be reserved for patients with profound respiratory stress. Overusing it could, potentially dampen the necessary immune response. It's a scenario where more isn't always better.
Yeah, and then there's the whole pregnancy angle. It's in Category C in the US, though Category A in Australia for oral use. I find that quite contrasting. What are your thoughts on that?
Well, it really comes down to risk-benefit assessments. In cases like promoting fetal lung maturity, the benefits might outweigh the potential risks, though use in prenatal treatment for congenital adrenal hyperplasia remains controversial because, only a small subset of fetuses are actually at risk.
Absolutely.
And there have been some serious adverse events documented in such off-label uses.
And outside of human medicine, it's even used in veterinary settings, right? Like for treating certain dog ear infections or in horses for limb swelling.
Exactly. Adaptability across species is another layer of its application. Combined with, say, marbofloxacin and clotrimazole, it turns into Orizon for veterinary ear infections. It's a real jack-of-all-trades, though its use is controlled to avoid abuse in sports, given that most sporting bodies ban glucocorticoids.
Now, what about its pharmacokinetics and interactions? I mean, it's got a high bioavailability of 80 to 90% and a biological half-life that stretches up to 54 hours. How does that influence its dosing schedule?
It means that you can effectively dose it once daily, and its prolonged duration ensures sustained action. However, due to enzyme inducers like barbiturates or rifampicin, the half-life might change. Also, concomitant use with oral contraceptives can alter its volume of distribution. So really, clinicians need to keep an eye on concurrent medications.
Right, that's quite a web of interactions. And I've noted that its immunosuppressive action, while beneficial in conditions like brain edema and autoimmune diseases, also predisposes patients to infections, right?
Correct. The flip side of dampening the inflammatory cascade is that you also compromise the body's ability to fight off infections. It's a trade-off, not to mention the risk of adrenal suppression and potential for withdrawal symptoms if it's discontinued abruptly after long-term use.
Absolutely. And people should really be cautious about that abrupt withdrawal. It can lead to adrenal insufficiency, hypotension, and a cascade of other symptoms.
Exactly. It really underscores the importance of careful tapering. And then, adding another layer of complexity, is its usage in oncology. When combined with agents like thalidomide or bortezomib, it's a key part of chemotherapy regimens for multiple myeloma. The interplay there is a perfect storm of maximizing anti-tumor effects while managing side effects.
Right. I always find that a balancing act. The more potent the drug, the more vigilance needed in monitoring adverse events. Speaking of which, how do you feel about the controversies around dexamethasone's use in, say, plantar fasciitis? It provides short-term relief, but there's no long-term benefit, right?
Yeah, that's an interesting critique. While the short-term pain management can be a lifesaver for some patients, the evidence doesn't support long-term structural improvement. In fact, repeated injections could potentially lead to tissue degradation and other complications. So, it's really a temporary band-aid rather than a cure-all.
That definitely makes you appreciate the precision needed in its application. And then there's the affordability aspect. It's quite inexpensive, making it accessible globally, which is crucial in both developed and developing nations.
Yes, cost-wise, it's a real winner. In places like the US, a month's supply is less than $25, and in India, a treatment course for preterm labor is around 50 cents. Such affordability has a huge impact on widespread use, especially in low-resource settings.
Absolutely, yeah. It almost seems like dexamethasone is one of those rare medications that successfully balances potency, versatility, and economy, despite the inherent risks.
Definitely. Its wide-ranging applications, from mitigating the cytokine storm in severe COVID-19 cases to managing chronic inflammatory diseases, make dexamethasone indispensable. Although, its adverse effect profile means it's not a first-line treatment for mild cases, but rather a targeted intervention for severe scenarios.
That's true. I also appreciate how the scientific community has used advanced analytical techniques, like IR, UV-Vis, and mass spectrometry, to meticulously confirm its molecular identity after synthesis. It shows the synergy between chemistry and medicine.
Yeah, it's like every peak in the spectrum, whether it's a mass spectral peak at 393.1 MZ or those NMR signals, is a piece of evidence that says we've got exactly what we need. It's truly elegant science that bridges the lab and
Very
the
elegant
clinic.
indeed. Before we wrap up, any final reflections on dexamethasone's journey from discovery to its current day applications?
I think its history is remarkable. Synthesized in 1957 by Philip Hench and quickly becoming a cornerstone in so many therapeutic areas, dexamethasone is a testament to the enduring value of well-researched pharmaceuticals. And its measured role in contemporary challenges like COVID-19 truly cements its place in medicine.
Right. It's one of those drugs that keeps evolving in its use, adapting to new medical challenges while remaining a staple in treatment protocols.
Absolutely. It's a brilliant blend of chemistry, clinical science, and practical application that continues to save lives, as long as it's used responsibly and with proper monitoring.
Yes, exactly.